I mean, I'm lucking out on this one. I mean, if you can be lucky and have cancer, okay? There's three words you like hearing in your life. Things like I love you, or when you have a child, it's a boy, it's a girl. But the three words that I just got a few months ago that I didn't ever want to hear is yes, it's cancer. I've been diagnosed with cancer of the ureter. And for lack of a better term, I mean, many people are going to know what the ureter is. It's the uh, manner of delivery from the kidney to the bladder. It's, in essence, better lack of a word here, it's a tube. So that's what feeds the urine into your bladder. But the whole story here steps back, and I want people to pay attention to this because it's important. Thanksgiving night, I had been for the week or two before working on a porch, and I was breaking up concrete with a sledge. Heavy, hard work. I tend to get a little bit possessed and not keep up on drinking fluids. I irritated my urinary tract because I kind of got dehydrated. But I also irritated a mass in my ureter that I did not know I had. And so on Thanksgiving night, I go into the bathroom to urinate, and instead of urine, I get pure old good blood. Yep, red blood. So to say the least, I was at the doctor the next morning. This wasn't my normal doctor. My regular primary care, who's wonderful, he was out of the office, so I had to see someone else. And he said, well, you've had a kidney stone before, or symptomology of a kidney stone, so it's probably just that. Let's get an ultrasound. So they get an ultrasound 4 days later, and there's nothing there. Now, I also needed to go see my primary care, who was back in the office 4 days later, because I was getting this elbow worked on. I had 5 free bodies floating in the joint. It's been there for years. It's the effects of years of martial arts training. You're going to have some damage. My sensei, his hips are blown out. We all end up a little messed up when you reach high levels. So I went to him and said, I had this thing happen with the bleeding. And he said, you need to see a urologist. Okay, well, it's the holidays. Trying to get into see a urologist or any specialist during the holidays here in the United States, it can be difficult, and it was. I didn't get in until January. So a month and a half goes by. In the meantime, in December, I have surgery on the elbow, and they bump my ulnar nerve, which is the nerve that, like your funny bone. And that controls this half of the hand. So this half of the hand is a little screwed up, and it's going to take, according to one physician, about a year for it to finally heal up. That was bad enough. You can live with it, though. It makes life a little difficult, to say the least, because you lose dexterity. But okay, so I see the urologist in January. And we get a CAT scan with contrast. That's where they put dye into your bloodstream. And they're better able to delineate different forms and things inside of you. And they see a mass in the ureter, in my left ureter. They are then going to do a scope. And I'm not even going to try to pronounce the word. I'll throw it on the screen because I can't say it for some stupid reason. So they go up there, up through the urinary tract. They do a biopsy in the bladder. Everything comes back negative. They do cystology, which is where they actually take, urine coming down from the kidneys, and they look for cancer cells there. There's nothing there, so I'm feeling pretty good. But the doctor says we had a problem. About the only skinny thing on me apparently is my ureter on the left side. So they put a stent in, which will stretch out your ureter, allowing them to have access next time. 2 weeks goes by, I go back to the hospital. This is all done under general anesthesia. They go back up through the urinary tract. They yank out the stent. They go into the ureter, and sure enough, they find a mass. They take a biopsy of it. Surgeon comes out, tells my wife, well, we found something, and I believe it to be cancer. He called me the next morning to personally let me know because I was a little bit groggy after all that. And tells me, yeah, he thinks it's cancer, but he hopes to God he's wrong. He said, I've been wrong before where I said, yeah, it looks cancerous, and it comes back negative. And he said, I would be nothing but happy if I was wrong on this. Well, 10, 12 days later, it comes back, and that's when he calls me and says, it is cancerous. So we plan our procedures, and we have various options that you can take. My background in writing a lot has been in health, public health, so I start researching this on all the legitimate sites. National Institutes of Health, different clinics, cancer societies, looking at all the research that's been done. So when he calls me and says, it is cancer, he says, well, we have 3 options, and he gives me these options. And I said, well, I can live with 1 kidney, and I sure as heck don't need a cancerous ureter. So that's what's planned. And that is coming up next week. I had planned on making this video earlier this week, and this is we're coming in the last week of May here. So think of that. You got December, January, February, March, April, May, and I'm finally getting my surgery. It's going to be robotic. They will take out the kidney and the ureter. The reason I was going to make it earlier is, well, I wanted to get this done and out of the way and get everything all taken care of before my surgery. And I got a letter from my health insurance company that the procedure was denied because it really didn't have any effect on the welfare of the patient, So I called them. My physician personally has called them a couple times. We finally got it pre-approved. It was a journey. You talk about let's add stress and depression on top of a cancer diagnosis. That's even, let's make it worse. But it, in the end, was approved yesterday afternoon. So, what they will do, and this is the reason I'm doing this video, I kind of want to explain the process that they do with the robotics and that. Now, I don't totally understand it. I have refused to watch any videos of them doing it because it really looks kind of overwhelming. But the physician literally sits at a console and controls the operating instruments through the robotic apparatus. They expand your abdomen so they have room to operate. They go in, they cut the vein and artery going into your kidney and seal that off however they do it. I was joking with my doctor, they use zip ties. They then go down to the bladder, and this is where it gets really kind of, to me, a little bad. They go up through your urinary tract first, make an incision around the ureter where it comes into the bladder. They then go with the robot from the outside, make an incision around the ureter. They don't leave any of the ureter because similar tissue, cancer is further up, and they have found, according to my surgeon, that if they leave a small piece of ureter, there is the possibility for that cancer to reoccur in that small portion. So you don't want that to happen. Supposedly 3 days in the hospital maximum is the normal. Possibly 2. I was lobbying for 1 because I get a little bit crazy being locked up. The thought of being in a hospital for 3 or 4 days does not sound pleasant to me. And then you're looking at 1 week of walking around with a Foley catheter up into your urinary tract with a little bag because you're going to have bleeding, because where they cut that section of the ureter out of the bladder, of course, they suture it shut. Excuse me. They suture it shut. But it's going to take time to heal up. You don't want pressure. You don't want blood clotting. So they do the catheter for about 10 days. So then it's about 2 weeks, apparently, to where you can, start feeling considerably better. And 4 weeks, Well, you're supposed to be able to go back to normal activities. Uh, Normal activities for me is 4 to 6 weeks. Normal activities like hiking, camping, splitting wood, digging up a garden. That's what I do. I found it interesting when I went to have my elbow repaired. One of the physicians said, well, a lot of people your age, because I'm in my later end of 60s, a lot of people your age, they just say, forget about it. All I do is watch TV. Well, that's not quite me or my wife. So, yeah, I'll be able to get back to normal activity if everything goes right, supposedly full bore after, let's say 6 weeks. Up until that 4 week part, it's like, well, don't pick up anything over 10 pounds. You don't want to rip anything up inside. Uh, so we're going to see what happens. This surgery, in theory, and it has illustrated this with all the studies, should be one and done. It should be able to do this surgery, remove the carcinoma, remove the kidney and the ureter, and hopefully it will not reoccur anywhere. I mean, you don't want it to reoccur in the other ureter because then you have a problem. The only thing it does do is it can tend to manifest itself in papillary tumors in your bladder. So I'm going to be getting checked for that relatively often for the first year. So I'm going to continue to do some videos here. I know I'm going really long on this, but the main point to this video is that if you have something like that happen, if you pass blood in your urine, don't sit back and say, oh, it's probably nothing. I have had absolutely no incidents of any more discoloration or blood in my urine other than Thanksgiving night. I could have easily said, oh, it was probably a kidney stone, don't worry about it. And then in a year or 2 years or whatever amount of time it takes for this monster to grow bigger, I've got a big problem. Right now it's contained in the ureter, and I want it to stay there until they take it out, okay? I don't need it going anywhere else, neither does anyone else. And I'm lucky, like I said, this looks like it's something that can be dealt with. It's rare. Apparently only 4 to 5% of the tumors in the ureter like that are cancerous. That's what the research I saw. It could be totally wrong. It could be 90%, but it doesn't much matter. I have it. So I will be doing some further videos as I have the surgery done during recovery to let people know how it goes and to let people who are going to be facing something similar know how it goes. And I'm making a long list of trips to take after my recovery. Backpacking trips, canoeing trips. If there's anything that'll wake you up to that, you need to get moving. It's being told you have cancer and that, yes, we can probably cure it. So that's it. Thank you for spending the time if you got all the way to the end of this rambling video. I appreciate it. And more to come. So I have an appointment with a robot in a couple days, and we'll see how it all goes. So again, thank you. And hey, do me a favor. Do this for me in the next few weeks. Get outdoors, have some fun. Be safe. Thanks.